My name is Justin Day. I'm going to be your nurse.
Hi.
How are you?
Tired, but I'm doing fine.
Okay. Can I get your name and date of birth, please?
Richard Lee, and my birthday is August 24th, 1996.
Okay, great. I'm just going to do a quick head-to-toe assessment on you. It's my understanding you're here for an annual checkup?
Yep.
Okay. Real quick, you already said your name. Can you tell me where you are?
I'm at the clinic.
Okay. Do you know what time of the day it is?
Time? No, but the day is like December 5th, I think.
Okay.
Yeah, I just wanted to make sure I did this part.
And can you tell me again why you're here?
Just to get a checkup.
Okay, great. So our patient here is A&O times 4. I'm going to begin by assessing your head. So I'm going to check your head, eyes, ears, nose, and throat for anything abnormal.
Okay.
Is there anything I can do for you?
No.
Okay. If you begin to feel uncomfortable or you need something during my assessment, please just stop me, let me know. We'll take care of that, and then we can continue where we left off. Sound good?
Yep.
Okay. So first thing I'm going to do, I'm going to inspect and palpate for any bumps, lesions, notches. I'm going to take note of the patient's hair. It's thick with no patches missing, shiny. I'm going to move on to check your eyes. So can you remove your glasses for a minute? All right, and just look straight at me. I'm going to check your pupils to see if they react to the light. All right, steer straight ahead. Okay. Okay. And can you look at the top of the light? And I'm going to bring it closer to your nose. Just follow it. Okay, great. Now I'm going to move in a couple different directions. So again, just follow it. Okay, so our patient has Perla and his EOM is intact as he went through the different directions. Can you close off one of your nostrils and breathe through it? Okay. And can you do the other one? Okay, perfect. Open your mouth, please. Say ah. Okay. Uvula is midline, shows rise and fall. Oral mucosa is pink, moist, no lesions, no dental caries. Okay. And I'm going to inspect the inside of your ears real quick. Okay, there's no discharge. TM is intact and pink. I'm going to do a quick test for you. So if you can cover one of your ears, your right side ear. I'm going to whisper something. Please repeat it to me, and then we'll do the other side.
Nachos.
Okay. Cover your left ear, please.
Taco Tuesday.
There we go. All right. Our patient is able to pass the whisper test. And one last thing with your head. Can you smile for me? Right? And then puff out your cheeks. Okay. Cranial nerve 7 is intact. Now I'm going to move on to your neck. And I'm palpating for carotid pulse. Okay. Great. He has +2 on those. I'm going to listen real quick. Great. What I was checking for there, it's called Brewy, and that's like a whooshing sound, and that's caused by turbulence or turbulent blood flow. Came back negative for that, which is a normal finding. And now I'm going to listen to your lungs. Great. Deep breath. So our patient has bilateral rise and fall of the chest, no adventitious lung sounds. Now I'm going to listen to your heart. And there's going to be another 5 spots I listen to there.
Smile is symmetrical and everything's working good. Alright, I'm gonna check your eyes now. Your eyes have no lesions, bumps, redness, any drainage or anything. And I'm going to do a test for paralysis. I'm gonna shine a light in your eyes. If you could just keep looking for straight towards me, please. Alright, if you move by people around you.
Got a steady heart rate, no murmurs. And for that last one, since we're just doing the assessment for mock purposes, in all actuality, you would hold the apical heart rate for a full minute. Right. And now I'm going to move on and check some of your other pulses. So can you hold your arms like this? Right. What I'm checking for is your radial pulses. Okay, we have those bilaterally. And on an actual assessment, I'm going to be checking his dorsalis pedis pulses. You would have the patient remove their socks, but for the sake of this, we're not going to. You would palpate down here, feel for those.
Do you have any use hearings?
Okay.
And how do you communicate?
And during this entire assessment, as I'm going through the different parts of the body on the patient, I'm taking note of his skin integrity, seeing if there's any lesions, bruises. The patient has pink undertones and his color is in line with his ethnicity. Great. One more thing for circulation. Can you hold your finger up? And I'm checking for your capillary refill. Right, another one please. Great. It's under 3 seconds, which is normal. Now I'm going to check your strength. So can you hold your arms like this? Alright, I'm going to try and pull back. Fight me. Okay. Now I'm going to try and push forward. Fight. Okay. Now I'm going to try and pull out your legs. And push. Okay. The patient has 5 out of 5 upper and lower strength bilaterally.
They are 2+ bilaterally.
Great. Now I'm going to check your abdomen. So can you lay down for me, please? I'm going to lift this up for you so you can put your legs out. Great. For the abdomen, first you want to inspect, auscultate, percuss, and then palpate. Starting with the lower right quadrant. So I'm inspecting for any abnormalities, deformities, masses, and I'm also checking the contour, which is smooth and flat. And now I'm going to start listening to those 4 different quadrants. And when I'm auscultating those different quadrants, I'm listening for vowel sounds, which just came back normal. If you don't hear any at first, you want to wait for up to 5 minutes for each quadrant before moving on. Now I'm going to percuss. Great. I hear tympanic tones with all 4 quadrants. Great. And now I'm going to palpate. Let me know if this hurts or anything. And while I'm here, I'm going to check for his bladder to check any distension, and then I'm going to palpate that. Does anything hurt or anything? Okay. All right. You can sit up. And another thing I'm going to check for percussion on his kidneys. So let me know if this hurts or anything. All right, Richie. This is going to include our head-to-toe assessment. Do you have any questions about anything?
Nope.
Okay. Well, then thank you for coming in, letting us take care of you today. And the doctor should be in a few minutes, and should be the rest of your checkup, and you should be good to go.
All right. Thank you.
All right. Is there anything else I can do for you?
No, I think I'm good.
All right. Thanks, Richie. Have a good day.